Senator Wyden.
Thank you, Senator Stabenow. All of you were excellent. I want to start with you, Mr. Panagidis, because I think what you showed today is that health care is the great equalizer. Here you are, as I understand it from Senator Van Hollen, you are an accomplished individual, you worked hard, you worked for a variety of different companies, and you were successful. That's the American dream. And then when you got sick and got Parkinson's, your health care costs went into the stratosphere, and now you're having to make sacrifices, and even with the sacrifices, it's hard to get by. My question to you, and then I'm going to go to you, Ms. Purvis, is I think that our legislation to put a cap on out-of-pocket expenses for someone like yourself who planned and always did the responsible thing, I think something like that would be of real help to you. Am I right about that?
Thank you, Senator. Yes, indeed. And you're very right. We did everything right. We have all kinds of coverage, and yet we have problems. In fact, I made an estimate that my wife and myself, the total cost for our coverage, premiums, plus what we pay for drugs, comes to $23,000 a year. So the cost, and also the premiums are high because the price of drugs are high.
Right.
And it's a vicious circle. So by all means.
Good. And Ms. Purvis, essentially, most private plans in America already have a cap on people's out-of-pocket expenses. And it's the government that's being a laggard here. Is it your view that Part D would really be improved with something along the lines of our Price RX, our RX Cap Act?
We are certainly well aware of the challenges facing Medicare Part D enrollees. There are some Part D enrollees, just based on the vagaries of the benefit, who are being asked to pay $10,000 per year. And if you think back to what I mentioned in my testimony about the median income, they're roughly half of their income for Part D costs alone. So yes, there definitely needs to be something done to help improve for them. On the other hand, we're also very mindful that when you cap out-of-pocket costs, there are some downstream effects that you have to be cognizant of, in the sense that when you hold, unfortunately, drug manufacturers, you hold down in one place, they can pop up in another. So we want to make sure that out-of-pocket costs, if they are held down, are done in conjunction with efforts to actually meaningfully reduce the prices as well.
Your point is a fair one, and that's why we think it's part, in effect, of a triangle, negotiating power and transparency and the Spike Act to hold down costs and the like. So fair point. Let me get your take on where things are for this year. So after the president is elected, then President-elect Trump said drug companies were getting away with murder, and people thought there were going to be some big changes. Then he went in the Rose Garden trying to make the case for his plan. But as you've heard me say, my view is it was mostly PR and choreography rather than a substance. And the prices are still high, and that's why we're hearing from your associates here on the panel, from the witnesses. So here's an objective question, because I don't want to, you all are charitable status, and I don't want to put you in a bad way. Since the president and Secretary Azar have been making these statements, what are, in your view, what are the major changes that actually have taken place that would hold down costs for people in this room? I haven't been able to find any major changes, but that's why we have you here. You're an expert in the field. By the way, I've enjoyed working with AARP since the days when I was head of the Great Panthers, so we've appreciated the relationship and the like. What, in your view, are the major changes that really help the people in this room?
I think one of the challenges in evaluating what has happened so far is a lot of it is to be determined. There are a lot of details that are outstanding. So while we very much welcome the idea of starting that conversation and putting some ideas on the table and starting to work towards implementing those ideas, it's very hard, at least at this point, because a lot of them are fairly long-term and do require a little bit more detail before they can be implemented. It's very hard to say whether there's been a meaningful impact for consumers. I can say that we have not heard from our members that prices have dropped.
You have not heard from your members.
That's correct.
Okay, so you juxtapose what Ms. Purvis has said with what the president talked about, how there were going to be all these price freezes and relief and like. Pretty big gap between the oratory of the president-elect and then the president and what Ms. Purvis, who, based on my experience with AARP, is very knowledgeable in this field, pretty striking. So I thank you, Senator Stabenow. I'm going to